3, 2, 1, V for Vijeta.
अरे नहीं, अब तो V for Vijeta Plus. Let's go.
यार जैस्मिन, तूने अपना FMG फर्स्ट अटेम्प्ट में क्लियर किया था। यार आसान था क्या यार तेरे लिए?
यार तूने भी तो फर्स्ट में किया था, तेरे लिए इजी था।
नहीं, मैंने पहले क्वेश्चन पूछा है ना, तो मेरे को छोड़ दे, मैं तेरे को बाद में बताऊंगा। पहले मुझे अपने बारे में बता।
मेरा पूछ भी मत, मैं इतना रोती थी। आई लॉस्ट 8 kgs ऑफ वेट। कोई एक जगह नहीं थी जहां बैठ के मुझे पूरी मेंटरशिप मिल जाए, मुझे PDFs मिल जाए, कंटेंट मिल जाए। टेलीग्राम्स के PDF डाउनलोड कर करके मेरे स्टोरेज भर गई। हर रोज नया व्हाट्सएप ग्रुप में ऐड होना पड़ता था।
ठीक है यार, तेरे साथ बहुत बुरा हुआ है, बट हेलो एवरीवन, टू एवरी FMG watching this and to everyone joining us today across the country, this movement is for you because the journey you have chosen is not an easy one. The foreign medical graduation exam, it is not just an exam, it is a gateway, it is a checkpoint and a test not just of your knowledge but your consistency, your discipline and your belief in yourself. Every year, thousands of Indians step out of their comfort zone, travel across the countries, pursue their dream of becoming a doctor and come back with one single goal: to serve in India, to wear that white coat with pride and to prove that they still belong to Indian healthcare system. And yes, FMG is challenging. It demands clarity, it demands revision, it demands everything that you need, but let's be very clear about one thing. It's absolutely crackable. Not with just random studying, not with last minute pressure, but with right structure, right mentorship, and right ecosystem. And that's exactly what brings us here today.
Because over the next few minutes, we are about to unveil, it's not just another course. It is a complete shift in how FMG preparation should be done. A system designed to take you from confusion to clarity, from inconsistency to discipline, and from preparation to performance.
And what we say, the right guidance. We don't just need content, we don't just mean here videos, we mean the people behind your preparation. Because in a journey like FMG, one right concept, one right strategy, and one that little push at the right time can change everything for you. And that's why at DocTutorials, we didn't just build a course, we brought together a league of mentors who have one vision to make you cross that finish line of 150. So tonight, you don't just hear about the program. What we are about to unveil is a comprehensive guide to cracking FMG. A complete roadmap that doesn't just tell you what to study, but show you how to study, how to revise, and how to execute under pressure. Because success in FMG is not just about information.
It's about direction. It's about having a system that guides you every single day of your preparation. And to bring that system to life, you will need the people who will shape your preparation. Ladies and gentlemen, let's welcome the force behind your FMG success blueprint.
Let's begin not from the textbooks, but from where it truly matters, the real clinical understanding, precision under pressure. Please welcome the Highness of Obs and Gynae, Dr. Gayatri ma'am. Welcome, ma'am. Ma'am, one question for you. Ma'am, what's the key to retaining the high yield point in Obs Gynae till the date of exam?
Okay, so hello guys. So regarding retaining all the key information to obs and gyn, one problem that majority of students face is obs and gyn is a very vast subject. But at the same time, if you cover it completely, it's a very high yield topic as such. You can get majority of the questions correct. As you know, nearly there are 35 questions that every time comes, and it's one of the strongest subjects that can be used. So first I would say, don't start with just revision. Sometimes I see students making all these shortcuts directly. Don't start with just revisions or taking shortcuts. First focus on your concepts. Your core clinical concepts has to be absolutely thorough. And even in the videos, you will have a real labor room kind of experience. We have introduced so many clinical videos into it as such, so that you can understand and learn it properly. Apart from that, there are many volatile areas that you can sometimes forget. So for that, revision is important. So second key point is focus on revision. You will be only able to revise it repeatedly if you have concise notes which you can revise it. So again, we have very concise notes. The whole of the subject is covered in nearly 50 to 60 hours as such, so that you will be able to focus on multiple times of revision. Finally, focus on active recall. Practice more questions. With the questions, you have to do an active recall as well. So I would say these are the three core things that you can do. First, clear your concept. Second, you focus on repeated revision. And third, you are going to do active recall with your previous year topics. I think with that, you'll be able to ace your preparation.
Yeah, I think that is more than enough to score 35 on 35 in obs gynae.
Because even the smallest subjects can cause big marks, please welcome the king of ENT, Dr. Rajiv Dhawan sir. Welcome, sir.
Thank you very much.
Sir, one question. First read to ho gaya. How to do revision now?
Actually, revision is actually the main thing. The first time reading in the class is the preparation of 3 future revisions. The problem is faculty बोल के निकल जाती है कि 3 revision के बिना पास नहीं होना, और FMGE की तैयारी में मिलते हैं 4.5 महीने लगभग, और नीट पीजी मिलते हैं 9 months मिलते हैं. 9 months में बेबी हो जाता है, मैम को पता है. 4.5 महीने में प्रीमेच्योर बेबी भी नहीं हो पाता, तो प्रॉब्लम बड़ी तगड़ी है. तो मतलब रिविजन, मल्टीपल क्विक रिविजन्स, फोकस्ड रिविजन, बट आर मच बेटर देन सिंगल एग्जॉस्टिव रिविजन. स्टूडेंट पहली बार में रिविजन में बहुत टाइम लगा देता है, और सेकंड रिविजन आते खत्म होते होते पेपर आ जाता है, तभी वो बात अटक जाती है. तो जो इस तरह कोर्सेज डिजाइन किए गए हैं वैसे हैं कि मटेरियल शुड बी कंसाइज, कॉन्सेप्चुअल, बट रिविजन शुड बी लिटिल बिट मोर फास्टर एंड सेरिब्रल, सो दैट आप 3 रिविजन खत्म करो और लास्ट वाले वीक में क्विक रिव्यू करो, और उससे आपके पास होने चांस बढ़ जाते हैं. ओके, थैंक यू वेरी मच.
Thank you so much, sir. Now, seeing what others are missing, please welcome the Bade Saab of Radiology, Dr. Khalil sir. Sir, एक क्वेश्चन है आपके लिए. What do you think? How does practicing image-based questions change a student's performance?
Hello everyone. I think images play a crucial role for all the exams that are coming up, whether it be NEET PG, FMG or INSET. Every exam you can expect 30 to 35 questions, and images are very loyal. They stick with you through your preparation and help you score good marks in your exam also. And images can be a very useful tool to revise subjects in a retrograde manner, especially when you are very tired, when you're exhausted and you want to have a quick review of the subject. Fast flip through the images can actually complete the revision for you, and use it effectively, and they are loyal. They stick with you through your preparation and help you score very well in the exam. Thank you so much.
I think this advice is very important for ones who are afraid of images.
Because every life matters, especially the smaller ones. Please welcome the Badshah of Pediatrics, Dr. Sandeep Sharma sir.
Thank you.
So how can students move from memorizing pediatrics to actually understanding it?
Okay, let me be honest. Except for the milestones part, I think if you are trying to memorize pediatrics, you are not reading pediatrics in the proper way. Pediatrics is like a child. You need to have some patience, and you need to, give your best in trying to develop that rapport with the child. Similarly, in pediatrics, if your concepts are good and you build them up and correlate clinically, I think this is one of the subjects where you can actually have 100% strike rate only if you prepare it correctly. So don't memorize, except milestones, of course, you'll have to memorize them. But remaining part of pediatrics, it's all conceptual. And that's what I try my best to teach at DocTutorials.
Thank you so much, sir.
Thank you.
Understanding beyond memorizing, let's welcome the Sultan of Psychiatry, Dr. Nadeem.
Thank you.
Sir, one question for you. Why do you think students सबसे पहले कुछ subjects ignore कर देते हैं and they regret later on that?
First of all the senior mentors and all distinguished people, very good evening to all of you. Yeah, about my subject, because see the mistake what students are doing, उनको लगता है सर्दी जुकाम बुखार तो है नहीं यहाँ पे, तो फिर क्या करना है यहाँ पे, तो उनको समझने में थोड़ा लेट होता है. तो बिकॉज मतलब कि टर्मिनोलॉजीज थोड़े डिफिकल्ट होते हैं, राइट? तो इसलिए दे स्किप सम काइंड ऑफ शॉर्ट सब्जेक्ट. बट द बिगेस्ट मिस्टेक इज दैट इफ यू आर गोइंग टू लीव शॉर्ट सब्जेक्ट्स, आई एम टेलिंग यू, short subjects will be having 100% accuracy. Once you understand this psychiatry, 100% score, like all questions you can solve. Last time from psychiatry in the FMGE, 15 questions they have asked. Right now? So please don't leave any short subjects. And yes, we are going to cover each and everything at DocTutorials. Thank you so much.
Thank you so much, sir.
See clearly, answer confidently. Please welcome the goddess of ophthalmology, Dr. Shivani Jain. Now one question. How important are images in opthal and how to recall them?
Okay, so definitely images form a very integral part of preparation if we talk about ophthalmology, because it's a core clinical subject. और मुश्किल भी है यार. बच्चे usually छोड़ ही देते हैं कि मुश्किल है, चलो opthal छोड़ दो. But definitely if you see the images, a lot of images, and usually they come in the exam also. So it makes the subject easier for you, for your understanding. और जब subject समझ में आएगा तभी आप retain कर पाओगे and you will be able to recall in your exam. So definitely images तो बनती ही है. And guys, if you are with us at DocTutorials live, ophthalmology will become a cakewalk.
Cannot agree more, man. Now, the backbone of FMG preparation, please welcome the god of medicine, Dr. Rahul Rajiv sir.
Thank you, everyone.
Sir, I would like to ask one question that each and every FMG aspirant want to know. Medicine is so vast. So what do you think, what is the biggest mistake that we are doing wrong here?
You're right, medicine is very vast. I have not finished studying medicine yet. So I just want to tell you that for an exam like FMG, sometimes a subject like medicine can be very overwhelming. So, but I want to tell you that for such an exam, please prioritize. The common mistakes is that the student doesn't prioritize. You have to know what are the high yield topics, what are the relatively low yield topics, and how will you understand what are the high yield topics from the previous year topics. And we have taken care of that in our lectures in the DocTutorials app. And once you watch those lectures, you will understand, okay, these are the high yield topics from which you will get a maximum yield, and focus on that, and we'll try to make it easy for you. Thank you, everyone.
Thank you so much, sir.
And where knowledge meets decision making, please welcome the Thala of Surgery, Dr. Raja Mahendran.
So, good evening all. Yes.
So why do students struggle to apply concepts in clinical questions?
A very nice question. To be frank, so the foreign medical graduates, there is a big issue. That is, they have no exposure to the direct patients. So when you read some core concepts and when you see the patient directly and you examine the patient and see the disease and see the surgeries, you will understand it 100%. So in DocTutorials, in this live session, I'm going to rectify that issue by bringing live surgery videos recorded in my clinic, in my hospital. I'm going to bring all those videos and I'm going to show you in the live lecture. So definitely with the live videos and lectures, and I'm going to bring approved patients, patient consented videos. I got a consent from the patient to show you in the lectures. I'm going to bring them who have attended offline classes, would have seen all those videos, and this time we are going to bring it in live online FMG class, and it is going to be totally different like any other surgery class. Eagerly waiting to see you all in DocTutorials FMG program. I'll be making you surgery சாதாரணமா சிம்பிளா முடிச்சிடலாம், வச்சு செஞ்சிடலாம், கவலைப்படாதீங்க. Thank you.
So what we are seeing here is that problem is not effort. Students are studying, but when it comes to application, they are struggling, right? So from scattered facts to structured details, please welcome the monarch of microbiology, Dr. Sonu sir.
Hi, good evening.
So one question for you also.
Yeah, please.
Sir, microbio, we study something today, we forget tomorrow. So microbiology again seems endless for students. What do you think? How can they approach it different, or how can I approach it different?
Actually, microbiology is full of facts. Okay, so many facts are there, and the best thing is to revise again and again. And the other one is what? That you have to make associations. And when you make associations with some absurd associations, they cling to the mind. And you should know what to read, what not to read. Another mistake which FMG fellows they do, they ignore this subject. They find it difficult. Okay, but if you think properly, it associates with every other subject. This is the most integrated one. It associates with medicine, PSM, ENT, Ophtha, everywhere we are. Surgery, microbes are there. So this is what is there, that you should not ignore this, and it should be like catering up to 40 marks in the FMG if you do it proper. Okay?
Correct,
Thank
sir.
you.
Visual learning at its best. Please welcome the diva of dermatology, Dr. Pallavi.
Hello.
Hi, ma'am. Why do you think students feel prepared but still make mistakes?
So that's a very common thing that we hear from the students after the exam. They come and say, "ये तो मुझे आता था, but ये ना याद नहीं आया, ये गलत हो गया." So they feel prepared, but they make these mistakes in the exam. ये क्यों होता है? सबसे important factor तो exam stress है. आप उस exam में बैठे हो, it's a very high stress, very high stake environment, long exam. So yes, anxiety kicks in, गलतियां हो जाती हैं. तो ये जो प्रॉब्लम है ना, नॉलेज की नहीं है, ये परफॉर्मेंस की प्रॉब्लम है. तो परफॉर्मेंस इंप्रूव कैसे करेंगे? हम प्रैक्टिस करेंगे. एमसीक्यूज प्रैक्टिस करना, जीटीज देना, एग्जाम को ट्रेन करना बड़ा इंपॉर्टेंट है. दूसरा रीजन गलती क्यों है, वो ये है कि हम पैसिवली रीड करते रहते हैं. वी जस्ट गो थ्रू पेजेस, वी आर रीडिंग. हमें लगता है हमने पढ़ लिया, हमने रिवाइज कर लिया, बट क्या हमने एक्टिव रिकॉल किया? क्या एक्चुअली आपको वो याद है? गलती वहां होती है. सो यू जस्ट डोंट हैव टू रीड, लाइक राजीव धवन सर सेड, सेरेब्रल रीडिंग. सो एक्टिवली रीड करना है, याद करना है, तभी आपको एग्जाम में वो वापस आएगा. रिवाइज भी करना है.
करेक्ट मैम.
सिर्फ रीड नहीं, रिवाइज भी.
Thank you, ma'am.
Because understanding why matters more than memorizing what, let's welcome the Pathan of Physiology, Dr. Naveen. सर एक जेन्युइन क्वेश्चन. जब हम फिजियोलॉजी पढ़ते हैं बहुत अच्छी लगती है, फिर भूल जाते हैं.
अच्छी तो बहुत चीजें लगती हैं लेकिन पठान बना ही दिया है तो पठान के में एक शेर है कि रोज सोचता हूँ भूल जाऊं तुम्हें, रोज सोचता हूँ भूल जाऊं तुम्हें, और रोज ये बात भूल जाता हूं मैं. तो जो चीज भूलना चाहते भूल नहीं पा रहे, तो याद क्यों नहीं होता है? तो दिल नहीं लगाते हैं. इट इज अबाउट हार्ट एंड सोल. हाउ मच हार्ट यू आर पुटिंग इन फिजियोलॉजी वी से लिम्बिक कॉर्टेक्स. तो फिजियोलॉजी में सिर्फ दो ही तरीके से आप याद कर सकते हो, या तो लिम्बिक कॉर्टेक्स अपना दिल लगाना होता है, और दूसरा होता है लॉन्ग टर्म पोटेंशिएशन, दैट इज रिवीजन. तो देयर आर ओनली टू वे. तो एक तो दिल लगाना होता है, लिम्बिक कॉर्टेक्स. तो कहते हैं ना कि आपसे अच्छे तो आपके ख्वाब हैं, जरा सी आंख बंद हुई वो आ गए. तो जब हम लोगों को ख्वाबों नहीं भूलते हैं तो फिजियोलॉजी क्यों भूल जाते हैं? तो बस दिल लगाना है. दिस इज मोर इंपॉर्टेंट. थैंक यू.
Because treatment begins with the right drug, please welcome the Thalaiva of Pharmacology, Dr. Nilesh Raj. One question, sir.
Yep.
So everybody feels so confident while studying pharmacology, but when we go to give the exam, we forget everything. How to help that?
Okay, see, first of all, we're not here to read the whole pharma. See, when you try to read the whole pharmacology, the same difference as we have seen here, no? Hair loss. Yeah. So don't try to do it more. If you do it more, there will be lots of losses for you. We are not here to design newer drugs. We are just here to answer certain questions which has been asked in the exams. Of course, pharmacology is difficult. I have not read pharmacology. I have never read pharmacology till now. I'm yet to learn pharmacology because even today, I think by this second, there will be 2 drugs which is getting approved and 5 drugs which are getting banned. It is very difficult to get updated on a constant basis, but how to solve certain questions primarily based on your QBank practices. As much questions which you practice, that much is going to be useful for your main exams. Make sure that you do the QBanks in a proper way, in a structured way, which has clearly been established in all of the QBanks and all of the questions which has been there in the Doc FMGE Live app. All the best, and we'll meet up as early as possible.
Thank you so much, sir. The silent rank booster, please welcome the Empress of PSM, Dr. Rajassi.
Your
Thank you.
So ma'am, everyone knows PSM is scoring, but फिर भी एग्जाम में जाकर everybody is underperforming. तो पता होता है क्यों गलती होती है, क्या गलती कर रहे हैं वो?
Okay, I'll tell you. Actually, as you all know, PSM is a vast subject. Definitely, you'll be getting around 50-60 questions every year. Okay, there were years when, 60-65 questions have come from PSM. At the same time, PSM is a dry subject, right? So what students tend to do is they simply try to mug up certain MCQs, then PYQs, try to recall some numbers, but it won't work that way. Moreover, PSM is something which are not properly taught in other countries, because PSM is all about what is happening in India, right? Like, about the national programs, then about the health system in India, which obviously others won't be able to teach you. Okay, we can't blame them. So that is one problem that PSM is facing. So what we have done here is, it's mainly concept-based teaching. Unless you understand the concept in PSM, you will not be able to apply it. And application part is very important in PSM, especially in FMG. So I would, suggest all of you to watch the videos, and in the live session, we will be making a complete concept-based teaching in PSM, which will definitely fetch you all the 60 marks. I mean, all the questions which are coming from PSM, and it will be a 100% rank. Okay.
Thank you so much, ma'am.
Small subject but big difference. Please welcome the dawn of FMT, Dr. Jay Prakash.
Hello.
Hello, sir. So, what do you think? What separates students who score in FMT from those who can't?
I would like to talk about 3 points. Number 1, congenital phenomenon. That is basic IQ of a person. Number 2, hardworking and hardly working. Number 3, luck, whether it is favored or not. Maybe I don't say 4, 3.5 point number. Stress. If a person is having lot of stress, automatically their performance go down. Always you should be very cool. Like how I lead my life, always cool. Even if I die, I'll be cool.
Ladies and gentlemen, the dawn of FMT.
Strength, structure, and strategy. Please welcome the Bahubali of Bones, Dr. Rohit. Sir, एक बहुत जरूरी क्वेश्चन.
Go ahead. Yeah.
Sir, what do you think is the difference between somebody who is cracking FMG and someone who is not cracking it?
ये तो बहुत ही बढ़िया सवाल है. Okay. So let me tell you 2 things. One is dedication, and second is the right guidance. Dedication is something that has to come from your side. Okay. So let me tell you frankly, if an FMG student can spend 8 to 10 hours a day for 3 to 4 months consistently, there is no reason in the world that he or she cannot pass the FMGE easily. That is the truth. But the problem is that I keep on getting messages saying that, sir, I cannot focus. I have this distraction, that distraction. I hardly study for 1 hour. And the next day I'm so stressed that yesterday I studied only for 1 hour. Now I can't even study for half an hour. So this is what happens. So the only thing is that you have to consistently study. And for that, the easiest way is to go for the right guidance. Okay, I heard you saying that while you were preparing for FMGE, you did not have the right guidance. You did not have the right mentorship. That's the exact problem that we are trying to solve here through the Vijeta program in DocTutorials. Here, we are introducing a live program where the topmost faculties of India of these 19 subjects are coming directly to your home, obviously via the internet, but they will be hand-holding you. They will be making sure that you spend the right amount of time studying the right material. So you are focused, you are not wasting your time studying unnecessary things, you are not distracted. That is the biggest advantage. And further, you also get other advantages, such as you get access to the recorded videos, you get access to the GTs, you get access to one of the best QBank that any platform is providing in the country. You get everything, and what is more, you get excellent mentors from the faculties. All 19 faculties here are excellent mentors. If you have any trouble, if you have any difficulties, you can always get access to them 24/7, and we'll all be there to help you. So welcome on board DocTutorials.
Precision, protocol, perfection. Please welcome the Majesty of Anesthesia, Dr. Swati. मैम सब बोलते रहते हैं हमेशा GTs दो. What do you think? How important is it to test yourself under exam-like conditions?
Well, actually a very, very important question. जब हम पढ़ाते हैं बच्चों को या मेडिकल स्टूडेंट्स को हम ट्रेन कर रहे हैं तो we go for a simulation training. Simulation में हम रियल लाइफ सिनेरियो देते हैं, फिर डीब्रीफिंग करते हैं क्या मिस्टेक हुआ. GT is that simulation before the main exam. Now GT को इस तरह से नहीं देखना है कि we have to secure the top rank in GT, and if I am not getting a good conversion or good marks in GT, it is something which is demotivating me. Now GT is something which is let's say which is prepping you for your final exam. So initial के GTs में what you have to do, you have to learn time management and you have to learn how to take the calculated guesses. Then as you proceed with more and more GTs towards your exam, you have to see that as you're covering all the content, what is your performance. So throughout, don't start giving GTs from very beginning. So it will make you more and more, let's say, prepared for your exam.
So now it's the time to go to the very foundation. Let's welcome someone who is sitting anterior to me, the legend of anatomy, Dr. Rajesh.
Good evening.
So first of all, I want to mention here something, that the first time in my first year, the first video that I watched for anatomy was yours on YouTube channel. So this is my fan moment with you.
It's always a pleasure. It's always a pleasure. We are in your service. At the moment, DocTutorials is bringing you the best possible what an FMG can get. And already you have watched all the faculties. They are top notch. And obviously, we are preparing you to get not only 150. We are targeting for 250. So that's what I always say, tell to the students.
So, sir, one question for you. So, FMG aspirant feel that they have studied anatomy, but they still lack clarity. What do you think? Where is that gap?
आई अंडरस्टैंड. इसमें होता क्या है कि जब आप पढ़ते हैं, जैसे एनाटॉमी पढ़ रहे हैं, कैडेवर के पास जाने से डरते हैं. हम कैडेवर से ही एनाटॉमी सीखते हैं. अक्सर हिस्टोलॉजी में स्लाइड्स होती हैं, बस होती ही हैं और हो ही जाती हैं, वो दिमाग में नहीं आती. हमारा पर्पस क्या है, जो आप मेरी टीचिंग में देखोगे, हम हमेशा ही आपका एक 3D ओरिएंटेशन देते हैं. हम हमेशा ये कोशिश करते हैं आपको 3D ओरिएंटेशन देने के लिए. देखिए, अब आपके एग्जाम में काफी सारे इमेज बेस्ड क्वेश्चंस होते हैं. हिस्टोलॉजी है या आपका डिसेक्शन है, उसमें जो एक 3D ओरिएंटेशन है बहुत इंपॉर्टेंट है. उसके लिए हम काम करते हैं. अच्छा, दूसरी बात यह है कि याद तो हमें हो रहा है, लेकिन उसको हम टेस्ट नहीं कर रहे, उसको हम कनेक्ट नहीं कर रहे. एक इंटरडिसिप्लिनरी अप्रोच है. आजकल क्वेश्चन ऐसे नहीं आते कि ब्रेकियल आर्टरी के आप 2 ब्रांचेस बताइए, नहीं. वो वहां से एक सर्जरी क्वेश्चन शुरू होगा जिसमें एनाटॉमी की नॉलेज चाहिए, या एनाटॉमी क्वेश्चन होगा इसमें सर्जरी. सो इंटरडिसिप्लिनरी जो इंटरकनेक्शन है वो हमें करना पड़ेगा. एज एन एनाटॉमिस्ट आई विल टेक यू टुवर्ड्स सर्जरी एंड देन सर विल टेक ओवर, टुवर्ड्स ENT, टुवर्ड्स ऑर्थोपेडिक्स, टुवर्ड्स एनेस्थीसिया, टुवर्ड्स रेडियोलॉजी. आप नाम लीजिए. मैं अभी हम बात कर रहे थे, माइक्रोबायोलॉजी भी है और फार्मा भी है. एनाटॉमी को आप कहीं भी भूल नहीं सकते, वो हम कर रहे हैं. और तीसरी बात ये है कि ये सब चीजें, जैसे सर ने कहा, लिम्बिक सिस्टम की जो बात है, शॉर्ट टर्म मेमोरी को लॉन्ग टर्म मेमोरी में आपने कन्वर्ट करना है और लूप को बार बार घुमाना है. बिना रिवीजन के कुछ नहीं हो सकता. तो यहाँ पर आपको एनाटॉमी आती है, पर पूछने वाला भी जानता है कि आपको क्या नहीं आता है, और वो चीज हम पढ़ाते हैं. और ऑब्वियसली 150 नहीं, 250. ओके, ऑल द बेस्ट. गॉड ब्लेस.
The bridge between concepts and disease. Please welcome the Queen of Pathology, Dr. Vandana Puri.
थैंक यू सो मच.
थैंक यू मैम. मैम, मैं एक बार पैथोलॉजी पढ़ती हूँ, बट मैं बाद में भूल जाती हूँ. हाउ टू रिटेन इट?
देखो, पैथोलॉजी को पढ़ने का ना बहुत ही सिंपल फंडा है. पैथोलॉजी को ना रट्टा नहीं मार सकते. यू कैन नॉट मग अप पैथोलॉजी, बिकॉज इफ यू ट्राई टू मग अप पैथोलॉजी विल मग यू अप. सो यू हैव टू अंडरस्टैंड दिस. पैथोलॉजी को डिवाइड करो. देखो, जनरल पैथोलॉजी, सिस्टमिक पैथोलॉजी, हिमेटोपैथोलॉजी और स्टेन्स एंड टेक्निक्स. अब प्रॉब्लम क्या है ना, स्टेन्स और टेक्निक्स किसी किताब में नहीं दिए, पर एग्जाम में तो आएंगे ही आएंगे. सो इसीलिए व्हेन वी डू दीज ऑनलाइन लाइव क्लासेस, इट्स वेरी इंपॉर्टेंट कि हम आपको बताते हैं कि देखो ये आ सकते हैं. अब इतने सारे हैं, इट्स अ स्काई, बट यू कांट रिमेंबर एवरीथिंग ना. तो वी टेल यू दीज आर द इंपॉर्टेंट वंस व्हिच कम. आई थिंक नोइंग एंड सीइंग, पैथोलॉजी की सबसे अच्छी चीज क्या है कि जब आप देखते हो वो आपकी विजुअल मेमोरी बन जाती है. सो when you see something, it becomes your visual memory and you will always remember that. But you should know what to see. सब कुछ देखोगे तब तो कुछ भी याद नहीं रहेगा. तो कुछ देखो, और जो देखो उसको याद रखो और कंसेप्ट्स बनाओ और उसको रिवाइज करो और रिकॉल करो जो यहाँ सबने बोला. That's it. Thank you.
So now, if we connect everything we just heard, students are studying but not consistently. They are revising but not retaining. They are practicing but not enough. They are attempting exams but without knowing where they stand. But most importantly, they are doing all of this without a structured system guiding them.
And that is exactly what we need to change. So the real question is, what happens when all of this is brought into one structured, powerful, live first platform? Ladies and gentlemen, let's show you FMGE Vijeta Plus Live.
नाम में ही है सर, विजेता प्लान विजेता ही बनाएगा.
The truth is, they start strong but lose consistency. They study but don't practice enough. They revise but forget at the wrong moment. They attempt exams but don't know where to stand. And somewhere between effort and execution, they lose direction.
So we have built something different. A system that guides you every day. A system that brings clarity, drives consistency, forces real practice, enables smart revision, and ensure rigorous testing. All with one goal: to make you exam ready. Introducing FMGE Vijeta Plus Live, not just a course, a complete preparation journey. And this is not just a launch, this is a promise that no FMGE aspirant should ever feel lost again.
And now I invite the entire force behind this mission, all our faculty, to join us on the stage. Please.
Ladies and gentlemen, this is your guidance, this is your system, this is your Vijeta team, and now on my count, 3, 2, 1, V for Vijeta.
अरे नहीं, अब तो V for Vijeta Plus. Let's go.